blood to the capillaries. Veins drain blood from the capillaries and return to the heart. Okay, so arteries away, carry blood from the heart to the capillaries. Veins return blood from the capillaries to the heart. So in between veins and arteries, you always have capillaries, so usually a bed of capillaries or a complex, which we'll talk about later. You never have an artery going directly to the vein, that would simply blow the vein out. So the artery has much higher blood pressure than the vein. The vein is not used to high pressure, so if you get too much pressure there, it can actually rupture the vein. So you always have arteries, capillaries, veins. Arteries carrying the blood out from the heart, supplying those capillaries, veins retrieving the blood from the capillaries and returning it to the heart. Okay, what we have here, a vein and an artery and some other structures as well. This is the artery. That white space there, that's the lumen in which the blood would be passing. And here's the vein. Again, that's the lumen where the blood would be passing. You can actually see some blood cells in this. And again, both basically have the same structure, same layers, composed of the same stuff, but the difference is veins are thinner walled than the corresponding arteries. Also, usually in close proximity to these blood vessels, veins, and arteries, you have these structures. Anybody know what they are? What is this? Something you should have studied in A&P 1, toward the end of the course. What was the organ system you studied? The what? The nervous system. Remember? Nervous system? And you were dealing with nerves, okay? Which are conducting impulses to various parts of the body. Or bringing from various parts of the body, receptors, back to the central nervous system, spinal cord and brain. Okay? So this is a nerve in section. It's like a cable full of long little wires. And what we see here, this cluster of wires, okay, within the cable, if you will, are nerve fibers. What are nerve fibers? These structures here. The nerve is a bunch of nerve fibers with supporting connective tissue. What are nerve fibers? Sure you talk about A&P 1. That sound familiar? Never heard it? Forgot it?
I heard it.
You heard it, that's good. But you don't remember what it was, right? All right, what's a nerve cell or neuron consist of? It's got a cell body. That's where the nucleus and main organelles are found. Then you have processes extending from the cell body. You got processes that carry impulses toward the cell body. Those are called dendrites. You may have a lot of those, like in a multipolar neuron. They have a process that carries impulses away from the cell body, usually only one, regardless of the type of neuron. And that's called an axon. So usually when we're talking about nerve fibers, we're talking about the axons of neurons. Okay? And a bundle those together with a supporting connection, connective tissue, in the peripheral nervous system, we call a nerve. Okay? Now in the central nervous system, right, in the spinal cord, we don't have nerves. We have tracts. Ascending tracts that run up and down the cord, for example. Okay. We also have ganglia. Anybody know what ganglia is? Heard the term, but don't remember what it was. A collection of cell bodies outside the central nervous system. Okay. Ganglia. Okay, but anyway, keep in mind you may see nerves in close proximity to blood vessels. From now on, though, I want you to be able to identify blood vessels so as not to confuse them with various ducts that we see in organs. Like in our salivary glands, we have salivary gland ducts. In your liver, you have hepatic ducts. Pancreas, you have pancreatic ducts, and so on. And you also have blood vessels. So I don't want you to confuse blood vessels with these various ducts that you'll be asked to identify. Okay, so let's look now at the blood vessels. We're going to start with the artery. Now the artery is usually smaller than the corresponding vein, but it's got a thicker, stronger wall. And again, here's the artery. is a corresponding vein. And note the difference. The vein is usually larger than the corresponding artery, but the arterial wall, relative to its size, is thicker and stronger than is the vein. But both arteries and veins have the same three tunics or layers, which I'd like you to know. And we start with a lining of all normal blood vessels, which is called the tunica intima or tunica interna. And that's a very thin layer, consisting of simple squamous epithelium, a single layer of flattened cells, and some connective tissue. So let's take a look at it in the higher magnification. Okay. And by the way, this we find in all normal blood vessels, including capillaries. Now, capillaries, the wall is basically the tunica intima. Simple squamous epithelium. See your kind of a red orange area. A little loose connective tissue supporting it. So that's the line of the blood vessel wall. Collectively, those cells are called endothelium. We talk about those when we're talking about the blood clotting process. That endothelial cells produce a lot of chemicals that control the blood clotting process and platelet formation. Now, normally this would be nice and smooth instead of folded or wrinkled. That's because when you fix the tissues prior to staining, it causes the muscle of the blood vessel wall to contract. That's why it's thrown in these folds. Normally it would be nice and smooth. As long as that layer remains intact, you don't get activated platelets, you don't get platelet plug formation, and you don't get blood clot formation. It's when you get damage to that epithelial layer on the inside, endothelial layer, it exposes collagen fibers here in the wall. If the platelets get activated, you get platelet plug formation, and eventually blood clot formation. Even though the vessel may not be broken or leaky, that's why you sometimes get internal clots forming in an unbroken blood vessel. What we call thrombi. They break free, and certain blood vessels are called emboli. We talked about those already. Okay, the middle layer you can see is a violet color. This is smooth muscle and elastic fibers, and it's known as the tunica media. So this is the middle layer, tunica media. When this contracts, you get vasoconstriction. It narrows the lumen, and that reduces blood flow. Remember, we talked about hemostasis, stoppage of bleeding. First step is what? Vascular spasm, which involves contraction of muscle and wall, which narrows the lumen and reduces blood flow. Also increases blood pressure. And then the outer layer is called the tunica adventitia or tunica externa. And this is connective tissue, usually dense or fibrous connective tissue, which further supports the wall. Okay? Now in arteries, usually the thickest layer, okay, is that middle layer. See right here, tunica media. And then the tunica adventitia. The tunica intima, single layer of cells in there, loose connective tissue. But again, the tunica intima basically makes up the walls of all blood vessels. And in capillaries, that is the wall. You don't have the smooth muscle in the tunica media, you don't have the tunica adventitia. But remember, it's the capillaries that are very porous, because that's where the exchange between the blood and other tissues occurs. It would be hard for things to cross the wall of, say, a major artery or vein. The wall's too thick. Okay? And again, when you see these arteries and tissue, because they got a thicker, stronger wall, they tend to hold their shape better. So they'll often be round or oval. You can see right here. Okay, now the veins have the same three layers, and the vein having a weaker wall tends to be collapsed or partially collapsed when it's in the tissues, especially when there's no blood in it. But again, you got the lining, which is the tunica intima, the tunica interna, as it is in arteries. Again, it's a little confusing here because you got blood cells actually adhering to the wall. Normally would not be. And then you got your tunica media, that's the middle layer. Again, you got smooth muscle, elastic tissue. Again, when it contracts, you get vasoconstriction. When it dilates, you get vasodilation, which increases blood flow. Vasoconstriction reduces blood flow. And the outer layer here, this is dense or fibrous connective tissue. And that again is the tunica adventitia or tunica externa. See the chart. Okay. So the same three layers or tunics, same tissue makes them up in both veins and arteries. And the difference is that arteries have a thicker wall relative to their size than corresponding veins. And because the vein has a weaker wall, it tends to collapse or be partially collapsed. So, as you can see here, they tend to be rather irregular in shape as compared with arteries, which are usually round or oval in shape. You see the difference. Artery smaller but thicker wall relative to its size versus the larger vein with a thinner wall. Okay? Any questions?
The blood volume is the same.
Sorry?
The pressure is different, but the volume is the same?
No.
Okay.
The big veins have a large volume, but almost no pressure. Okay? So like, for example, the superior and inferior vena cava, the blood pressure sensitivity is 0 by the time it gets back to the heart. And that's why we need some help to get the blood back. It was just blood pressure generated by the contraction of ventricles, we couldn't get the blood back. And many of the same things that push the lymph along, skeletal muscle pump, respiration, okay, pulsing arteries, stuff like that, they help to move the blood in the blood veins.
Okay.
Okay, any other questions? Okay. I'd like to go over with you some differences